So imagine you are about to lift a massive weight off the ground. You step up to the bar, take a huge deep breath, you hold it in to stabilize your spine, and you pull.
Oh, it's a terrifying visual, honestly, when you've been told your whole life that doing that is dangerous.
Right. I mean, for years, women, especially postpartum women, have been warned that doing exactly this, holding your breath under heavy strain, will just completely destroy your pelvic floor.
Yeah, the idea that one heavy squat could just ruin your internal anatomy forever.
Exactly. You're told you'll cause, permanent leakage or trigger something called prolapse. But as we dig into the sports science and modern clinical guidelines for this deep dive, we're finding out that this old school advice isn't just slightly outdated, it is flat out wrong.
And it's keeping millions of people away from the exact exercises that could actually heal them, which is the real tragedy here.
Which brings us to the central question of today's deep dive. Can breath holding during exercise actually worsen pelvic symptoms? We've gathered a massive stack of sources, physiotherapy manuals, clinical research, sports science articles, to really get to the absolute bottom of this.
It's a lot of material to cover, yeah.
But before we get into the gym mechanics, I think we need to establish a baseline. What exactly are we talking about when we say prolapse? Because we hear the word thrown around as this ultimate boogeyman, but what is mechanically happening in the body?
Well, mechanically speaking, pelvic organ prolapse is basically a failure of support. So inside the pelvis, you have organs. You've got the bladder, the uterus, the rectum,
Right.
and they are held in place by this really complex web of connective tissues, ligaments, and a muscular sling at the very bottom, which is the pelvic floor.
Okay.
When those supporting structures become overly stretched or weakened or maybe damaged from childbirth, they can no longer hold the organs up against gravity and internal force.
So the organs actually start, descending or pressing into the vaginal wall?
Exactly. That's what creates that heavy dragging sensation or even a visible bulge that patients so often report. And the stakes here are incredibly high. Our sources note that up to 50% of postpartum women experience some degree of pelvic organ prolapse.
Wow, 50%. That is half.
Half, yeah. It's incredibly common.
And the mainstream advice they get is cloaked in so much fear.
Right.
They go to a doctor and hear, never lift more than 40 pounds again, or stop squatting immediately, or my personal favorite, just lie down for all your exercises.
Right, which is just so impractical.
It is. If you are someone who loves to be active, who loves to lift, or, I don't know, who just has to pick up a growing toddler every single day, that advice is completely demoralizing. Okay, let's unpack this.
It is demoralizing, and according to modern rehabilitation protocols, it completely misses the mark. I mean, avoiding heavy lifting doesn't cure prolapse.
Really?
No. In the long run, avoiding heavy loads actually accelerates muscle atrophy, which can make the prolapse worse. The real culprit here isn't the 40-pound dumbbell.
So what is it?
The culprit is a hidden pressure system inside the body that is just not being managed correctly.
Okay, so if the external weight isn't the enemy, but the internal load manager is, we have to look at how that manager actually operates, right?
Exactly.
And looking at the sources, you really can't understand how holding your breath affects a heavy lift without first understanding what a normal, everyday breath does to your pelvic floor.
Right, because most people think of breathing as an isolated event that just happens in the chest. Your lungs fill with air, your ribs flare up, and that's the end of the story.
Just a chest and lung thing.
Yeah. But optimal breathing, what the clinical sources refer to as a 360 breathing pattern, is a full-body mechanical event. It involves the entire trunk of your body.
So I was reading to the physiotherapy manuals in our stack, and several of the older texts rely on this seesaw analogy to explain how the diaphragm, the muscle right under the lungs, connect to the pelvic floor.
Ah, yes. The seesaw.
But I have to admit, I found that completely confusing. I mean, a seesaw goes up on one side and down on the other. Are they saying the diaphragm goes down while the pelvic floor goes up?
No, and that's a brilliant catch. The seesaw analogy is actually a deeply flawed relic in some of the older literature. It's much more accurate to picture like a piston or an elevator shaft.
Okay, a piston makes a lot more sense to me. Walk us through that.
So imagine your core as a closed, flexible cylinder.
Okay.
The diaphragm acts as the roof of the cylinder, and the pelvic floor is the foundation at the bottom. When you take a deep, optimal inhale, your lungs fill with air, which forces the diaphragm to expand and press downward.
Right.
And because this is a closed pressure system, when the roof presses down, the internal organs are gently compressed. That force has to go somewhere.
Oh, I see.
So the foundation, the pelvic floor, must yield. It naturally relaxes, drops, and lengthens downward to accommodate that shift in internal load.
Wait, so the pelvic floor is actively moving down on the inhale. It's yielding to the pressure.
Yes, exactly. In biomechanics, this is called eccentric lengthening.
Eccentric lengthening.
Right. The muscle is stretching while still maintaining a gentle, supportive tension. It's not just collapsing. It's catching the weight.
Got it.
Then, when you exhale, the mechanics completely reverse. The diaphragm moves back up into the chest cavity to push the air out of your lungs. And as the roof rises, the foundation, the pelvic floor, gently lifts and recoils back to its resting position.
So it's down together on the inhale and up together on the exhale.
Exactly. Down together, up together.
That completely shatters the way most people visualize that muscle group. I mean, it is not a rigid brick wall holding your organs in. It's more like a dynamic, responsive trampoline.
A trampoline is a perfect way to look at it.
And if you are listening to this right now, you can actually test this yourself. Wherever you are sitting or standing, try taking a very deep, slow breath into your belly and ribs. Just focus on your pelvis. You should theoretically feel a subtle downward release, like a slight softening as you inhale.
And if you don't feel it, and this is common, if you feel the exact opposite happening, that is your very first clue that your internal force distribution is out of sync.
Wait, the opposite, like sucking your stomach in when you breathe?
Exactly. Many people spend their entire lives doing this shallow chest breathing where the diaphragm barely moves at all.
Right.
Or worse, they do reverse breathing, where they suck their stomach up and in on the inhale out of a habit of trying to look slim.
Oh, wow, yeah. Just holding it all in.
Yeah, and that completely short-circuits this natural, beautiful feedback loop between the diaphragm and the pelvic floor.
Okay, so if that piston system is supposed to move fluidly with every single breath, what happens when we throw a wrench in it by intentionally trapping the air?
Ah.
Because to go back to our barbell example,
Mm-hmm.
athletes hold their breath all the time. To do a heavy deadlift, you take a huge gulp of air, you hold it, and you pull. Let's define this quickly for anyone who isn't a powerlifter. That technique is called a Valsalva maneuver, right?
Yes, it is. A Valsalva maneuver is essentially the act of taking a deep breath and attempting to forcefully exhale against a closed airway like your closed vocal cords.
Okay.
You are intentionally trapping the air to create a highly pressurized, rigid core to support your spine.
But I really have to push back here. If I hold my breath and lock my core right now, I can literally feel the pressure bearing down into my pelvis.
Sure.
So how can the sports science say that is safe for someone with prolapse? If I can physically feel that downward force, does holding your breath automatically damage those tissues?
What's fascinating here is that the science gives us a highly counterintuitive answer, and it directly addresses what you are feeling. Holding your breath, when executed as a proper Valsalva maneuver, does not inherently harm the pelvic floor.
Really?
No. The sources highlight a pivotal 2012 study that really flipped the script on this whole thing.
How did they prove that? Because everything about holding your breath feels like it would just shove the organs down.
The researchers actually measured intra-abdominal pressure and the physical descent of the pelvic floor during heavy lifting.
Wow, okay.
And they found that in healthy, coordinated lifters, a Valsalva didn't blow the pelvic floor downward. The actual danger, the mechanical error that causes the damage and worsens laxity symptoms, is a very common mistake called bearing down.
Okay, we need to draw a very thick, bright line between those two things.
Definitely.
Because if I'm staring down a barbell, how do I know if I'm doing a safe Valsalva or a dangerous bearing down? Like, what is the mechanical difference?
It all comes down to coordination and where you direct that internal load. In a proper Valsalva, you are creating a balanced, rigid cylinder. You take the breath in, but instead of pushing your belly out, you expand your ribs laterally, like out to the sides.
Okay, lateral expansion.
Yes. Your abdominals are braced like a corset, tightening inward. And crucially, your pelvic floor is actively engaged, lifting up to meet the internal pressure.
So the force is distributed evenly across the rigid walls of the cylinder rather than just being dumped into the floor.
Precisely. In fact, to learn this coordination, many pelvic floor physical therapists teach women to initiate a heavy lift by starting to exhale first.
Wait, starting to exhale before holding the breath?
Yeah. You start blowing out air to trigger that natural upward recoil of the pelvic floor we just talked about. Then in the middle of the exhale, you close your throat and hold your breath to lock it in.
Ah, So the pelvic floor is already braced and lifted before the maximal load even hits.
Exactly. Now, bearing down, on the other hand, is the exact opposite. It happens when someone lacks core stability.
Right.
They take a huge breath, and instead of expanding their ribs and bracing inward, they push their belly out and forcefully direct all of that trapped air straight down into the pelvic cavity.
Okay, the sources used a toothpaste analogy for this that I thought was incredibly vivid.
Yes, the toothpaste tube perfectly illustrates bearing down.
Right, it just makes total sense. If the cap is tightly screwed onto a tube of toothpaste, which represents your closed airway, and you aggressively squeeze the dead center of the tube, all that paste rushes to the bottom. And if you squeeze hard enough, the pressure blows out the weakest seam at the very bottom of the tube.
Yeah,
That is bearing down.
exactly. And if your pelvic floor is the weakest seam, the force stretches those supporting ligaments, pushes the organs down, and actively worsens the prolapse.
And that downward shear force is exactly what causes stress, incontinence, or leakage during a heavy lift too, right?
Yes, that's exactly it.
But, this really brings the conversation out of the gym and into everyday life. Because you don't just bear down under a barbell. You could be making this exact mechanical error while pushing a heavy stroller up a steep hill.
Absolutely, or even just coughing repeatedly from a severe chest infection.
Right.
The sources specifically highlight chronic coughing, whether from asthma, smoking, or illness, as a major risk factor for prolapse.
Why? Just because of the pressure.
Yeah, because a violent cough is just repeated, forceful downward pressure against an unprepared pelvic floor.
Wow. Even straining on the toilet due to constipation. It's the exact same mechanical failure as a bad deadlift.
It is, which is why the clinical guidance today insists that we have to identify the patient's pressure driver.
Pressure driver, okay.
Yeah. If you complain of a heavy, dragging sensation in your pelvis, a good physical therapist won't just tell you to stop deadlifting. They will look at how you manage internal force all day long.
Right.
If you are unconsciously holding your breath and bearing down every single time you pick up a toddler or push open a heavy door or strain in the bathroom, you are repeatedly traumatizing those tissues.
So if downward force is blowing out the system, the logical solution, and the thing I think almost everyone assumes, is that you should just hold your pelvic floor as tightly as possible all the time.
Right.
Here's where it gets really interesting.
Oh, yeah.
People think, just clench it, do 1,000 Kegels a day,
Yeah.
build a fortress down there so absolutely nothing can fall out. But the sources reveal a massive paradox here. Doing endless Kegels and constantly bracing out of fear will actually make prolapse and leakage much worse.
It is arguably one of the most detrimental things a person can do for their pelvic health. The medical term for this state is hypertonicity.
Hypertonicity.
Right. It means the pelvic floor muscles are simply too tight, locked in a state of constant low-level spasm.
Okay, I need you to explain the why behind this. Why does being too tight cause weakness? I mean, if a muscle is clenched, shouldn't it be strong?
Think about your bicep.
Okay.
If you walk around all day with your elbow bent tight and your bicep clenched as hard as you can, what happens when someone suddenly hands you a heavy box to carry?
My arm is going to be completely exhausted. The muscle would probably just give out and drop the box.
Exactly. Because the muscle is in a constant state of fatigue, it's starved of oxygen and blood flow. A pelvic floor works the exact same way.
Oh, wow.
If it is chronically clenched, it cannot eccentrically lengthen. It cannot yield and drop down on the inhale. And because it cannot relax, it has no range of motion left to properly contract and lift on the exhale when you actually need it to handle a sudden spike in internal load.
Like a sneeze or a heavy squat.
Right. A hypertonic pelvic floor acts exactly like a weak pelvic floor. When the force hits, it just fails.
That makes so much sense. And the sources gave some incredibly specific and, honestly, sometimes embarrassing symptoms that point to this exact problem of being too tight.
Yes, they did.
One of them is vaginal flatulence, often referred to as queeving. I think a lot of people experience this during exercise like yoga or Pilates and have absolutely no idea why it's happening, or they feel deeply ashamed of it.
It is a classic mechanical sign of poor force distribution and a hypertonic pelvic floor. If we look at the mechanics, a tight, spasming pelvic floor acts like a rigid suction cup.
A suction cup.
Yeah. When you move into certain wide-legged or inverted positions, that rigidity creates a vacuum that actually pulls air into the vaginal canal.
So it's sucking air in because it can't move fluidly.
Exactly. And because the muscle is exhausted and lacks dynamic control, it can't release that trapped air naturally and silently as you move. Instead, when your intra-abdominal pressure suddenly increases, like When you stand back up or shift your core, that tight muscle acts like a whistle. It forcefully and audibly expels the trapped air.
The suction cup and the whistle. That is a brilliant way to visualize it.
A healthy, well-coordinated pelvic floor maintains a good resting tone, which keeps the vaginal canal narrow so air doesn't rush in to begin with.
Okay.
And because a healthy muscle moves dynamically with the breath softening on the inhale, recoiling on the exhale, any tiny amount of air that does enter is released smoothly and silently.
You know, the sources also mention another major red flag for a tight pelvic floor, which is deep pelvic pain after running. A pain that often mimics severe menstrual cramps.
Yes, that's very common.
You go for a 3-mile run, you carry 2 to 3 times your body weight with every single foot strike, and your pelvic floor is just clamped down in a state of absolute panic the entire time. No wonder it feels like cramping afterwards.
It feels like cramping because the muscle is literally screaming for oxygen. It is in ischemic pain.
Ischemic pain.
Right. And this perfectly illustrates why the old school advice of just do more Kegels is so dangerous. If you have a hypertonic pelvic floor and you try to fix your prolapse symptoms by doing more Kegels, you are throwing gasoline on the fire.
Because you're asking an exhausted, oxygen-starved muscle to clench even harder.
Precisely.
Okay, we've completely deconstructed the old rules. If breath holding done wrong bearing down is harmful, and overbracing and clenching is equally harmful, what is the mechanical alternative?
Right. How do we actually fix it?
Yeah. If someone is staring down a heavy barbell or, frankly, just trying to carry groceries without leaking, how do we rewrite the rules of exercise for them because we established sitting on the couch isn't the answer?
The modern rehabilitation strategy is entirely focused on mastering the internal load manager. And the golden rule in the clinical guidelines is this: do not jump straight to surgical repairs or laser treatments without first addressing how you manage pressure.
Because surgery doesn't fix a bad habit.
Precisely.
Okay.
If you have a surgeon stitch up a prolapse, but you go right back into the gym and bear down like a tube of toothpaste every time you lift or cough, you will simply blow right through the surgical repair.
Oh, man.
The pressure driver has to be fixed first.
So let's get incredibly practical. What are the step-by-step strategies from the sports science literature that someone can literally take to the gym today?
Well, the foundational technique is something called the knack.
The knack.
Yeah. It is a conscious, deliberate pre-contraction of the pelvic floor. The goal is to draw up and engage those muscles immediately before any activity that causes a spike in internal load.
Okay.
So right before you cough, right before you sneeze, or right before you pick up a heavy kettlebell, you actively lift the pelvic floor.
You're kind of bracing the foundation before the heavy furniture gets dropped on it.
Exactly. You anticipate the force. You don't wait for the load to overwhelm the system. You meet it proactively.
I love that. And what about managing the breath during the actual movement? If we want to avoid bearing down entirely, how should we breathe during, say, a heavy squat?
That brings us to the second major strategy, which is exhale on exertion. Physical therapists often teach this as blow as you go.
Blow as you go. Catchy.
Very catchy. When you are executing a lift, you want to breathe out during the hardest part of the movement. So let's use a squat as an example.
Okay.
You inhale on the way down, allowing the diaphragm to drop and the pelvic floor to yield and lengthen. Then, as you hit the bottom and push to stand back up, you forcefully exhale.
Because exhaling naturally cues the pelvic floor to lift back up.
Yes, exactly. Exhaling bleeds off the excess intra-abdominal pressure so it doesn't get dumped into the pelvis, and it triggers that natural upward recoil. You are finally working with your anatomy instead of against it.
What I found really empowering in the sources is this concept of symptom-led progression. Because if you Google exercises for prolapse, you will find endless, arbitrary lists of good core exercises and bad core exercises.
Oh, yeah. The internet is full of those lists.
But the clinical consensus now is that we should throw those arbitrary lists out the window.
They are completely useless.
Right.
Because every single body manages internal load differently. A standard plank might be perfectly safe for one person while causing massive downward bearing down for another.
Well, that makes sense.
Yeah, so symptom-led progression means you listen to your body's specific mechanical feedback.
What does that feedback actually look like, practically speaking?
Well, if an exercise causes your stomach to dome, meaning you see that ridge of pressure pushing out along your midline, or you experience leakage, or you feel a heavy dragging sensation in your pelvis the next day, that is your body telling you something.
That the internal load manager failed.
Yes. It failed for that specific weight or position, and you strained the connective tissues.
But it doesn't mean you can never do that exercise again,
Yeah.
right? It just means you aren't ready for it yet.
Correct. You need to drop the weight, modify the position, and master your breathing mechanics first. Conversely, if you do a heavy deadlift using a safe Valsalva or a blow-as-you-go technique, and you feel absolutely great with no symptoms during or after, then you keep doing it.
So if we connect this to the bigger picture, why is it so critical that we master these mechanics? Why not just stick to lightweight, seated machines and avoid the heavy lifting altogether?
If we connect this to the bigger picture, it's because the pelvic floor does not exist in a vacuum. Total body strength is a prerequisite for optimal pelvic floor function.
A prerequisite.
Absolutely. The pelvic floor relies heavily on the strength of the glutes, the deep transversus abdominis muscles, and the diaphragm to share the load.
Oh, I see.
If you avoid squats, deadlifts, and overhead presses out of fear, those surrounding support muscles atrophy. And when your glutes and deep abs weaken, the pelvic floor is forced to work overtime just to stabilize your pelvis.
Which leads right back to hypertonicity, exhaustion, and dysfunction.
Exactly. Building total body strength so you can function well in everyday life is a non-negotiable requirement for long-term pelvic health.
So what does this all mean? If we zoom all the way out on this massive stack of research, we've learned that the pelvic floor is a dynamic piston, not a static hammock.
Right.
We've learned that holding your breath to brace your spine isn't the villain, but bearing down like a squeezed tube of toothpaste absolutely is.
Definitely.
And surprisingly, trying to aggressively clench your way to pelvic health with endless kegels might just leave you with a hypertonic, exhausted system that mimics weakness and causes pain.
The ultimate takeaway from all these sources is that a diagnosis of prolapse or experiencing leakage is not a life sentence to sit on the sidelines.
That doesn't mean your body is broken.
No, not at all. It is simply an invitation to master your body's internal pressure system. It's about learning to coordinate your breath, your deep core, and your pelvic floor so they work as a unified, responsive team.
It completely flips the narrative from fear to empowerment. The weight isn't the enemy, ignorance of our own mechanics is. But before we wrap up, I want to leave you, the listener, with one final, slightly provocative thought to mull over.
Oh, I like this.
We spent this entire deep dive talking about how we manage our breath and our internal load during heavy, intense exercise. But take a second and think about what you are doing right now. Think about how you breathe when you were just sitting at your desk, stressed out, staring at an email you don't want to answer, or sitting in traffic.
Oh, that's such a good point.
Are you holding your breath right now? Are you unconsciously bearing down and pushing pressure into your pelvis while you type? What if the way you breathe during your most mundane, stressful daily tasks is secretly training your pelvic floor to fail before you even set foot in a gym?
It's a vital question. The physical habits we build in our quietest, most stationary moments dictate our strength in our heaviest ones.
Something to keep an eye on, or rather a breath on. Thank you so much for joining us on this deep dive into the hidden mechanics of the body. Keep questioning, keep learning, and we will see you next time.